everybody, welcome to our channel. Hope everyone has had a happy Thanksgiving weekend. My name is Dr. John Lucio. I practice integrative medicine and pain management in Jefferson City, Missouri, and this is my wife.
Hi, I'm Dr. Jennifer Sue. I practice conventional gynecology and integrative medicine. Today's a really good subject. If you've never subscribed, please do so. We upload 2 videos a week all about integrative medicine approaches to medical topics. You can comment below what you'd like to listen to in the future. That's how we get our content. Hit that notification bell so you know when we've uploaded our next video.
Today we're going to be talking about prostate cancer. Now I'm not going to be talking about things like specific treatments, nutrition and so on. We covered that in another video, but I'm going to be discussing things that your doctor probably didn't talk to you about. First of all, let me talk to you about a little bit about the diagnosis. And as most of you have known, I had prostate cancer last year and I did undergo a prostatectomy. So I kind of have firsthand experience.
It's been a whole year.
Yep, we just completed a year.
November the 9th.
In terms of the diagnosis, a lot of you will find, and men will find that if their PSA is slowly rising, that you're going to have discussions with your physicians about, well, should I have a biopsy? Should I not have a biopsy? What if it's not positive? Is it an infection? You may find that your PSA continues to go up in spite of all the treatments you've had, and it's time for a biopsy. So what they do is they'll do a biopsy. It can be done in the office. But then the unfortunate thing about biopsies is that sometimes they do not find the cancer, and you will have to undergo what is called a prostate MRI. And I actually had that done, and actually that's when they found it. My PSA had been slowly going up, my biopsies have been negative, and they actually found it. So
didn't they watch you for like 8 years?
Right, and it just started getting too high at the point we needed to do something different. So my urologist suggested we do the prostate MRI, which is like the best thing I ever had done because it did find that I had the tumor, and he was able to use that MRI scan to actually pinpoint where to do the biopsy. So it's very important. If you don't have a prostate MRI in your area, or physician can't refer you to one, find someplace close by that'll do it because it's going to be well worth your effort. Okay, so let's say you get to that point. So now you've been diagnosed with prostate cancer. You're going to hear a lot about your what's called a Gleason score. That determines what stage that they think the prostate cancer is at, and it also determines your treatment. And I'm not going to go into too much detail with that because that's an entirely different lecture and really needs to be done between you and your urologist or your family doctor. So let's say you get to the point where you are discussing treatment plans. Now you're going to have options like radiation, surgery, waiting. Now prostate cancers do grow very slowly, so that is an option in some men. But if the Gleason score is too high, it's probably not a good idea from my personal opinion because you never know when the cancer is actually going to start to spread and start to grow faster than you anticipated. In my case, I opted for the surgery. You're going to have 2 choices. One's going to be the laparoscopic radical prostatectomy or what they call the open radical prostatectomy. Both have their pluses and minuses. I picked the laparoscopic technique because I found a very good physician, had a good reputation. That's something that I felt in my case would be a more rapid recovery. So that's the choice you do have to make, and there's a theoretical advantage with the laparoscopic prostatectomy that you have less side effects afterwards. Some people say that's not true, but again, in my case, after everything I read, that's what I chose.
It's really important, if you're going through this, bring a family member or someone that loves you with you, because I think it helped us to make a decision to make. Yeah. And it also helps your partner to know what the options are. And even after making that decision, we waited, I think it was a month before we had yours. 2 months, so they might not do it right away.
Yeah, and she brings up a good point, is that really needs to have a discussion with your family. And this is the very most important part of this whole process. You really have to have a discussion. You have to know what to expect afterwards. One of the 2 big things that you have to discuss with the family is the understanding that you are not going to be the same person you were before your surgery. Number 1, you're going to have urinary incontinence. That's just part of it. I think it's maybe 1 or 2 cases, and my surgeon said he only knew of 1 case where the patient after the surgery didn't have urinary incontinence, but I'll talk about that a little bit later. And the erectile dysfunction. Let's just put it out there because it's just almost, you'll get it with almost every surgery, no matter what the technique you use, and there's some various degrees of it, and there's treatments for it. After the surgery, I didn't have too much pain. My biggest issue really was the side effects I had from the pain medication. It was worse than the actual surgery, which is one of the most common with pain medications, constipation. So make sure that you start on a stool softener almost right away, just to keep your bowels normal.
Because the place where your bowel movements come out is very close to where the surgical site is, so if your bowels are too hard, it'll be very, very painful.
Yeah, and I started myself almost right away. I used Colace twice a day. And so as I mentioned, it was more of an ache after the surgery. It was tolerable. The biggest problem I had is that I had to wear a Foley, and this is what every man has to do after the surgery. Just accept it. Some men are going to have to wear it longer than others. Unfortunately, when I wore it, it was extremely painful towards the very end. That's because I didn't know this, but I was developing a urinary tract infection. And that is actually one of the side effects that can occur. You can get an infection, you can get bleeding intra-abdominally after the surgery, and it's easily treatable. It's no fun. I'm going to tell you, it's really no fun. It took me weeks to recover from that.
Another thing is that his nurse, upon discharge from the hospital, gave us one of the best advice. See, the Foley bag is the bag that catches your urine. And she said you're going to be tempted to wear that leg bag to sleep at night because it's more comfortable. It just attaches to your leg. But she said don't do that. Like, switch it out to the big bag that hangs by your bed. She said that's going to just be a lot better, and she's right. Because if you don't do that, the leg bag, which is attached to your leg, will leak and it'll go all over the bed. So make sure you change it to the bigger bag at night. Takes a little bit of time to do it, but it's worth it.
Yeah, and please don't get frustrated. There's a light at the end of the tunnel. You just gotta wear this thing until the time it's appropriate.
That's true. Can you address how good your doctor was about teaching the Kegel exercise?
I forgot to talk about that more. One of the techniques, of course, is something called the Kegel Exercises, and the urologic surgeon actually went over those with me, and I was very religious about doing them, and they're very effective and they're easy to do.
What I really liked about his urologist, that he taught him all of that things before the surgery, so they had 8 weeks to practice his Kegel exercise. And not everybody gets that from their urologist. So if you're seeing a urologist and you realize that he or she is not teaching you how to do a Kegel exercise before the prostatectomy is done, that you ask them particularly, please show me how to do it. I, as a gynecologist, thought I knew how to teach a Kegel. Now I actually feel the patient's vagina to feel a Kegel. Same with his doctor. He said, Jennifer, wait right here in my office. I'm going to take your husband to the next room. And he actually showed him the proper way to do a Kegel by touching certain parts of his body at the right place, so he knew that he was doing the right Kegel exercise. Because I used to tell our female patients, oh, you just squeeze a muscle if you don't want to pass gas in public. It kind of gets it, but it's not really. So now I actually place 2 fingers in their vaginas and I have them squeeze my fingers. That's the right Kegel. And I don't know what he did with him, but he showed my husband exactly how to squeeze.
Be prepared to start using after the Foley's out, start using some type of absorbent product that you can get over on the line or even get it at the grocery store, because you're going to be using that for a while, and as time goes on you'll start using a smaller and smaller one, or even less often. So afterwards, the Foley comes out, then you start to recover, everything is going okay. In my case, I was not able to do any type of exercise for 2 months. When I started to do that exercising, I noticed I was extremely weak and out of shape, and that was very frustrating for me. I do like to exercise, and it was just very hard to get back into that. But slow but surely you'll get to that point. Now, let's talk about the erectile dysfunction issue. That can go on for months after the surgery. In some cases I've read it's gone over a year. There are various things that your doctor will prescribe. The top 2 are Cialis and Viagra, which you can use. Some people, it just does not work. The best advice I received was that, again, try different techniques. After a while it starts to recover, but it can be very, very frustrating. And this is a time that's particularly vulnerable for couples. So yeah, if you didn't expect this or really discuss this before your surgery, this is where we'll have problems, because you can't rush this. I've had one former patient that had this, and it was after 2 months he was just beside himself for the fact that he could not have intimate relationship with his wife. And you know, I asked him, I said, is this a problem you have, or is this a problem your wife has? And he said it was within himself. So don't get discouraged. It does take a while, and you're even gonna, I've read articles where even months after the surgery, when men have sex and have an orgasm, because you can still have an orgasm, it is actually quite painful, and that will go away with time as well, and that you'll always feel that ache for quite a bit of time. But again, don't get discouraged.
I think it's really good that what he brings up about your relationship with your partner is just like anything. You guys are a partnership, so you need to let your partner know what you're worried about, what your concerns are, what they're worried about, what their concerns are. So things in life happen, and intimacy is not always traditional sexual intercourse. Intimacy as we get older changes. Our joints don't work, things don't work, and so that's the beauty of being with someone for a long time, is going through those changes. So it actually strengthens your relationship. Look at it as a strength. Don't look at it as a problem. This is something that makes your relationship even deeper and more fulfilling.
Let's say you try the medication. As time goes on, you've given it time for everything to heal, but you're still not where you need to be. So what other things can you use? Well, there's protocols where I've seen where people use low-dose Cialis in addition to what they call a penis pump. That seems to also work as well. The important thing is that that tissue needs to be stretched. Okay, these are things, unfortunately, I never had this kind of detailed discussion with my own physicians, and I had to do a lot of this on my own research. And actually, I learned more from a course that Jennifer took with Dr. Runnels in Alabama. When he was talking more about women's health, he started to talk about men's health as well, where he does a pee shot.
The Priapus shot. The Priapus shot is so useful for men, either where they just cannot keep an erection, or the erection's not hard enough, or they have impotence where they cannot have an erection. So it's very important to look up www.priapusshot.com and give us a call if you're interested in me helping you with any of this. And it's safe, and like he said, we'll use I draw a small portion of your blood, spin it down, and then I would inject your own platelet-rich plasma back into your penis.
Combine that together with a penis pump and maybe even a low-dose Cialis.
When there's no downtime.
Right. So let's say you've done all this stuff and you're still not getting to the point where you need to go. There are a type of injections that your urologist can prescribe that can be done at home. They do have side effects, but they are very effective. This whole type of treatment is called penile rehabilitation, because the nerves that you need to get an erection have been damaged, or in some cases bruised, and still not functioning. So you need to do something to keep that tissue in shape. Just like when you work out, if you don't exercise, you're gonna get deconditioned. The same thing with your penis. So have a plan as time goes on what you want to do. If point A doesn't work, then you got to go to plan B, plan C. But don't get discouraged, because there's a lot of options out there, and most people do very, very well with it. There are some cases where patients have had to get other techniques, such as a penile implant. Those are some cases, they're appropriate for some people, not appropriate for others, but those are cases where absolutely nothing else has worked. All right, that's it for today.
I can't wait till our midweek check-in.
Yep.
It's going to be, if you have back issues or back pain, back injuries, what are some simple exercises that are safe for you to do?
Yeah. And again, I hope this video was instructional enough for you, and I hope you learned from it. If you have any questions, please let us know. For those men that are going to be going through prostatectomy, my heart's with you. Good luck with everything, and take care.